Hello friends, in our last video we spoke about the four domains of aging and better understanding of those four domains to provide anti-aging. Now in this video let's talk about the further four mediators of aging, because if we know the mediators then we know where we need to hit and to provide any degree of anti-aging, age management, or again I will say hypothetically age reversal. I'm using this word hypothetically because we are doctors and we should not claim anything. Whatever has to be claimed or whatever is to be claimed should be having strong evidence base, scientific evidence base in a very large number of population or a sample size. So it will take time. But till then, please stay away from the claims. You should not fall prey to any claims about any product coming in the market and claiming to be anti-aging or causing age reversal. Let it be stem cells or NAD or glutathione or anything. Stay cautious. Okay, so now let me come back. So yesterday we spoke about aging. We spoke about four domains of aging, right? And what were the four domains yesterday? We spoke about them. I'll not go in detail today. Body composition, bioenergetics, homeostatic system, and your neurodegeneration. So if we can work on these four domains by any means, lifestyle modification, exercise, dietary restriction, calorie restriction, so-called intermittent fasting, medication, surgery, whatever, optimum sleep, yoga, meditation, involvement of your doctor, involvement of your spiritual guru, involvement of your yoga instructor, involvement of your teacher, involvement of your surgeon, involvement of whoever. If these four can be taken care of, your age with the quality of life, we talk about the quality of life, that can be reversed significantly. Number will not be the quality of life. Now, for these four domains, these are the macro thing, right? That's the macro part. Okay, body composition we are working, bioenergetics, homeostatic this, and neurodegeneration. Now let's talk about the mediators. What four mediators we can work on and which are available in today's world, so that we can impart some sort of anti-aging or age reversal we as doctors can provide, and the people themselves can acquire them, definitely through the advice of the doctor, their doctors, and under very strict supervision. So what are the four mediators of aging? See, anything what is happening in aging process more or less happening through these four mediators. There might be or there would be definitely be more mediators, but primarily these four. These four. One, hormones. So hormones are primary mediator controlling the aging process, and the physical and to very significant extent the mental, psychological, and sexual aspects of the aging. So if this can be corrected, lot of impact of aging on an individual can be reversed to a very significant level, not 100%. Second, neurotransmitters. So the neurotransmitters, again, your mood, your memory, your concentration, your responses to the stress, how you are behaving with the people around you, how you are responding to your own ecosystem, how irritable you are, how happy you are, how sad you are, is all controlled by the neurotransmitters. And with aging, the neurotransmitter response start getting blunted. So if this can be corrected by any mean, the lot of impact of aging can be reversed. Third, inflammation or the inflammatory mediators. So with aging, what happens is the pro-inflammatory versus the anti-inflammatory system of the body start guiding more towards the pro-inflammatory side. We start getting more inflammation, and our anti-inflammatory response of the body start getting suppressed. So body goes in inflammation. Inflammation is equal to aging. A very simple phenomenon. So if anything can be done to decrease inflammation, whatever can be. Again, whether it is medically or non-medically. Medically, by using the anti-inflammatories. Non-medically, by optimum sleep, good mood, good food, clean water, clean air, no pollution around you, clean thought, all of this, yoga, meditation, blah, 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 many things, spirituality, inflammation can be decreased. Good fruit diet, no fried food, no lot of non-vegetarian in your diet. When I say no lot of, I'm not anti non-vegetarian. I'm not saying that somebody, one person cannot have non-vegetarian food. For the optimum protein supply, non-vegetarian food is required, and whoever where there are no restriction religiously or culturally can have the non-vegetarian food. So I want to make this point clear. And the fourth is oxidation. So oxidation and inflammation go hand in hand. So the oxidative damage in the body is actually taking us towards the aging process. So if things can be done to counter this oxidative process inside the body, it will help in anti-aging. And what? So like antioxidants, vitamin C is one of the strongest antioxidant what nature has given. So vitamin C, melatonin. Again, I come back: clean air, optimum sleep, good exercise. All these things will help in antioxidation. So if there is any modality which work on these four mediators, or the combination of the modalities which can work on these four mediators, anti-aging to certain extent can be achieved. So anytime anybody asks you for anything, okay, this you do this and it is going to bring anti-aging, or you eat this product or you consume this supplement, first you see whether it is working on these four domains. If it is working on these four domains, that modality, that act, or that food, or that supplement, or that medicine, or that procedure may help you to get some anti-aging. I hope this video works. In the next video, we will start talking more detail about them, and maybe we go more cellular level and talk about the anti-aging at the cellular level. So signing off for now, this is your friend Dr. Deepak Chaturvedi. Thank you for watching. Thank you so much.